So welcome to this second video where we'll be looking at the surface anatomy of the posterior lower limb. As we did in the previous video, we'll be starting off looking at the bony landmarks on the skeleton. We'll then try and apply these to our figure before using that to add our muscle compartments and looking at some important details that we can see. So first off, let's try and find these bony landmarks on our skeleton. The first one I'd like to find is the ischial tuberosity. That's going to be this roughened area at the inferior portion of the pelvis. The greater tuberosity, that lateral bump at the top of the femur. We come down our medial and lateral epicondyles on either side of the knee joint, just above the condyles. The head of the fibula will be this lateral projection here that you can feel just below your knee joint. And if we follow the fibula down, we come down to our lateral malleolus on the lateral side, and the medial malleolus will be on the medial side of the ankle. And then finally we have our heel bone, the calcaneus, projecting inferiorly and posteriorly down there. And these are the major landmarks we want to try and find on our figure. Now some of these will be easier to palpate than to see. A good example of this will be the ischial tuberosity. If someone sits down, they sort of flex their hip, it can become quite prominent, but when they're stood in an upright position, it's normally covered by the mass of Gluteus Maximus. We're going to have to guess roughly where it will be on here, but I'd estimate it about here. So if we imagine the pelvis coming down like this, the sacrum in the middle, that ischial tuberosity should be there. The greater trochanter will be this bump over here on the lateral side. The medial and lateral epicondyles. This line is the fold of the knee, which would be represented here on the skeleton, so they'll be just superior to that, roughly here and here. The head of the fibula. Can you just see, if we follow the line along the outside of the leg, that little bump just here? That's the head of the fibula. The malleoli, fairly clear to see, that medial malleolus slightly higher, that lateral malleolus slightly lower. And then finally calcaneus, the heel bone. Posterior, inferior, it'll be the bump at the very base of the foot. And so again, once we have these bony landmarks in, we can use them to infer the position of the bones. So I've already drawn a suggestion of where that pelvis is. We'll have the head of the femur, that ball sat inside the acetabulum, sending a long neck back, out laterally towards the greater trochanter. Again, remember that femoral shaft comes down on an oblique angle, and then widens out to form our knee joint, those condyles on either side. The tibial plateau sits below that, in between the condyles and the fibula head. So that's our tibial plateau, which will extend all the way down to the medial malleolus. We follow the tibia down on that medial aspect over to here. The fibula, meanwhile, runs from the fibula head to the lateral epicondyle, almost straight down in this position. Between them they form the joint, our ankle joint proper, which has the calcaneus sat just below it. So when we have that, we've got our bones in place, we can add some muscles over the top. First off, I'll try the gluteal muscles that are covering up this area around the lateral and posterior aspect of the hip. We can see really nice and clearly that curvature of Gluteus Maximus. The Gluteus Maximus passes diagonally down from the pelvis in this kind of direction. Got big attachments that are sweeping down to here. And if you can see that line at the lateral border, that's the point where the muscle stops, and it becomes a long tendon, a wide flat tendon, that joins the tensor fasciae lata on the lateral side of the hip. So this here is the tensor fasciae lata, with the muscle fibres of Gluteus Maximus over here. Remember that Gluteus Maximus doesn't fill all of the shape of the buttocks, so we have fat on that inferior aspect, and then the muscle above it. Gluteus medius and minimus will be above that, coming over and into the hip. We then have our posterior compartment of the thigh. Now this will be our 3 hamstring muscles. They originate from the ischial tuberosity proximally and travel down to just below the knee distally. We can see the lateral line will be that line we added in for the tensor fasciae lata. The medial border, just this line here, that's where gracilis is, in the medial compartment, so I'll add in gracilis. And if we extend that line up towards the ischial tuberosity, this is roughly the area we'll find those 3 hamstring muscles. And they come down below the knee on either side. Finally, we have our compartments in the leg. And pretty much all we're going to see from the back of the posterior compartment, these are big, powerful muscles that bulge out. So we're not going to see a huge amount of the lateral compartment. We certainly won't see any of the anterior compartment from this view. So I'm going to draw around it again, this big bulk, this big shape that we see here. That's our calf muscles in the posterior compartment. They come down to this long, thin, but very strong tendon, the Achilles tendon. I think the strongest tendon in the body. Like so. So we have a muscle belly up here and tendon below. The lateral compartment running from that fibular head down behind the lateral malleolus will fill up this space on the lateral side and sweep around to the lateral side of the ankle. Once we've got those compartments roughly penciled in, so our posterior thigh, our gluteal region and our posterior leg, we can now come in and add a few more details and see which features we can pick out. Coming to hamstrings, we've got 3 hamstring muscles, biceps femoris, semitendinosus and semimembranosus. We have one that goes laterally, so over to this side, this will be our biceps femoris. And we can see that curve, that line here, this little divot here where that second head joins. So biceps femoris, one head here, coming together to a single lateral tendon. On the medial side, semitendinosus and semimembranosus travel down to a similar attachment. We have tendinosus slightly more proximal, forming this very thin, long tendon at the back of the knee. And membranosus will be deep to it, starting off with a wider, flatter tendon at the ischial tuberosity. When we come down into the posterior leg, the main muscle we see is that powerful flexor of the ankle, our gastrocnemius muscle, and that has 2 heads, a medial head, a lateral head, that will attach to the femur. So remember, this muscle crosses the knee joint. It splits into those 2 heads, medial and lateral, and because it crosses the knee joint, it will also have an action at the knee. So gastrocnemius, an ankle flexor and a knee flexor. At the inferior border, we can sometimes see, just round about here and here, a suggestion of that soleus muscle, that wide flat flexor of the ankle that lies deep to it. But you may not always see that so clearly. The lateral muscles, fibularis longus and brevis, they travel down on the lateral side behind the lateral malleolus. Fibularis brevis stops on the lateral side of the ankle, while fibularis longus travels all the way underneath the foot and attaches on the medial aspect of the ankle. Finally, we've drawn our muscles, we've got a rough idea of where they are. The final thing to add in is an important clinical space that's formed by the 2 sides, the 2 borders of the hamstring superiorly, and inferiorly by the 2 borders of the 2 heads of gastrocnemius. Together they form a diamond-shaped space with no muscles in, and this will be our popliteal fossa at the back of the knee. And so that's it. That's the end of our drawing. Hopefully, if you've drawn along, you should have 2 drawings of the anterior and posterior leg. Please, if you had to judge this, I'd love to see how you get on with your drawings. Other than that, good luck with your studies. Hope that you're staying safe and healthy, and we'll hopefully see you again soon. Cheers.